So building a pharmacy is building a specialty pharmacy, right? You've got certain things that you need to put in there. You need space, you need refrigerator. Can you walk me through kind of some basic qualifications you need to build one, and then maybe also take me through the steps it takes to get accredited so that you can start, participating in network with some of these medicines?
Yeah, so that's a really good question. It is a big, long process that requires a lot of resources, a lot of effort, a lot of time. That's one of the things we do to help is we take that off your plate so that we can take on that initiative and we can put in our time and our effort to get this pharmacy off the ground. So the process is, it's intricate, but it's simple. We have to have the space. We have to make sure we have access to drugs. We have to make sure that we have employees, pharmacists. We get into those clinics and really work with the providers and make sure that we have a good relationship with them as we start to build pharmacy, or specialty pharmacy. And then we take the steps towards accreditation. So there are pages and pages of accreditation standards, both the URAC and ACHC, that we're going to partner with you right alongside you to make sure that we have the policies in place, the standards in place, the protocols in place to meet those accreditation standards once we raise our hand for accreditation.
How long does it take to obtain accreditation?
It does depend. And I think that it's important to think about that. Yeah, it does depend. And I think it's important to remember that you can start filling prescriptions on day one. And we work to find those prescriptions that you can fill immediately as we work toward accreditation. And, accreditation can take 6 months to a year, and it depends on the health system that we're working with and, integrating into their resources.
There are steps too that you have to take before that accreditation. You have to have reporting in place, you have to fill prescriptions. So we're filling those prescriptions day one without accreditation. But, like Heather said, it may take 6 months, it may take a year, but you're filling the prescriptions, you're getting in the networks with the PBMs to be able to fill prescriptions. And then as you kind of get the process stood up, get the pharmacy stood up, get the procedures and policies in place, you're able to become accredited.
And that's a big point too, Lauren, because one thing we haven't talked about are all the things that we have to measure and monitor in a specialty pharmacy as we work toward accreditation.
Yeah, tell me about it. What are we measuring and monitoring?
So in a specialty pharmacy, when you become accredited by ACHC and URAC, you have to keep certain metrics for your phone calls. So that means there is a body in the pharmacy every single hour that they're open, answering the phone call within 30 seconds. Sometimes we can't even open or answer our own cell phones within 30 seconds, and we're having to have enough bodies and enough pharmacy personnel in there to answer that phone. And that means that our patients are getting immediate access. They're getting immediate contact with the pharmacy personnel to have their questions answered, to make sure they're getting the right appropriate care. And I think that just goes to show how URAC and HCHC accreditation really proves that you're a great specialty pharmacy and that you're taking care of your patients in the best way.
Comprehensive, and that is true. And one of the things that we can do to help with that whole process is track and measure and then report back to those bodies the data, so that lift is not on the health system, but we take that off of them. In addition to that, there's the patient monitoring, there's the clinical assessments that have to be tracked and measured.
That's right.
Clinical pharmacists, you want to talk about that one?
Yeah, every patient that is a specialty pharmacy patient is monitored by a clinic pharmacist. So that means initial assessment. You're going in, you're asking them, what medications are you on? What side effects have you had? An initial assessment all the way down to what other medications are you on? And then they're going to be working right hand in hand with the provider to make sure that the regimen is appropriate, that it is up to date, that it is the most accurate regimen for the patient and their disease state. And then also monitoring yearly. You're monitored yearly by a pharmacist where you're continuing to review side effects. Are you having any issues taking your medication? Have you skipped any medications? Has it affected your disease state? Those types of things. But you're getting continuous monitoring by that clinic pharmacist. And all of that is reported back to ACHC and URAC and the accrediting bodies to make sure that that's happening. So not only are we saying that it's happening, but we're also reporting it and bringing it back to the accrediting bodies.
You mentioned patient satisfaction, and that's a big driver, answering the phone, within 30 seconds or less. But, also required are the patient satisfaction surveys. And those are required by an independent third party. And so you are held to a high standard. And we make sure that those standards are met and exceeded. So we are looking at processes. What does it take to make those patients know that we care about their outcomes and that we're ensuring that they have the access to the medication and the appropriate medication by working with the providers closely.
Another thing that's really important in a specialty pharmacy is most, if not all, of the medications that we're dispensing out of the specialty pharmacy are being delivered to your door. So a patient, you get the medication prescribed to you by your clinic physician, and then you're going home and you're waiting for that package. Specialty pharmacy drugs are very expensive. We've alluded to that already, but a lot of them are refrigerated. Some of them must be frozen. Some of them need to stay at room temperature and can't get too hot or too cold. And so something that's really important for a specialty pharmacy to have, and the accrediting bodies require, is shipping and packaging, and having a cold chain vendor that is allowing you to ship and package those medications at the appropriate temperature. So not only do we have, and we can vet vendors to allow a cold chain process that's allowing us to ship those medications to the door at the appropriate temperature, we have processes and policies in place and required testing that we have to do to make sure that what we have works and that the medications get to your door at the appropriate temperature and aren't ruined before they get to you.
A lot of stuff to monitor. Sounds like a lot of stuff to integrate. What's the technological burden? I mean, how are you monitoring this and how are you integrating back with the hospital system?
Well, I think the short answer is that when we partner with the health system, there's not a lift for them to monitor this data because we're doing it for them. So we have our own platforms and we pull that data. We create the outlooks, the output from our analytical tools to report back not only to the accrediting bodies, as Lauren's mentioned, but also to the payers, to the PBMs, because when we're trying to get access for a patient to their PBM so that we can bill them for their care, we have to also report to them a lot of metrics. And so all this stuff we're talking about measuring and monitoring, we have to also report to them just to even get in their network. Same thing for manufacturers. We have to report to them as well to get access to their medication. So there's a lot of reporting that goes on, but we take that lift away from the health system.